In this tutorial today, we're going to be showing you how to navigate to your ED Summary Mpage. We're going to show you how to get to the Mpage and offer you an overview of the user interface that you'll always be seeing when you're logged in. First, we're going to have you log in with your username and password. After logging in, this should open to the ED All Beds tab, showing you the FirstNet tracking shell. We'll have you highlight a patient and click on the blue arrow that appears to the left of the patient's room number. After doing this, it automatically takes you into your ED Summary Mpage. This is the place where you're going to be able to find the most information about your patient. The first box that you're going to see is medications. This will show any medication that the patient has been prescribed. Any home medications, any kind of medication that they've been given in the emergency room. The small plus sign next to this is where you can actually go in and add medications. The next tab is your home medication list. This will offer after the nurses are placed in the medication list tab. All the patients with medications, this is where they will appear. Your next box is your allergies. This will populate with any allergies that the patient may have after they've been placed. The Problems tab will show any and all problems or injuries that the patient has had in the past. Your immunization box will show any immunizations that have been given, or if they're up to date or out of date with your patient. The next box is your procedure history. This offers any kind of surgical or procedural history that the patient has had completed. Social history will show any type of social history background alongside smoking, illegal drug use. This is where that information would appear. The next box is your family history. This will show any kind of family history diseases. Your next tab is the Vital Signs tab. This will show all of the last 4 hours of any vital signs that have been completed and placed in the patient's chart. The next tab is the New Order Entry. Here you can click the blue plus sign and go in and add any new orders for this patient that you feel they may need. The next tab is your Labs tab. This tab will show you any resulted labs for this visit. You can actually go back and select previous visits to look at their other lab results for comparison. The next box is your Diagnostics. This will show you any type of radiological diagnostic tests ordered, EKGs that have been placed on this patient. Also offering when you can go back and select a previous visit for comparison. The next box is your Outstanding Orders. This will show if any orders need to be completed on this patient. The next box is your Flagged Events. This is just to show you if there's anything that needs to be done on this patient or any event that needed the attention of a physician or any caregiver. The next tab is your Microbiology tab. This will show you any kind of microbiology labs that may have been ordered. The next box is your Document box. This will automatically take you to the clinical notes portion of the patient's chart, where you can see other kinds of assessments that caregivers have done on this patient. The next tab is your Visit tab. This will give you any visit that the patient has had into the emergency room. The next tab is the Intake and Output. This will allow you through any type of intake and output. The next tab is the Patient Information tab. This will show any demographic information on this patient. The next tab is your Diagnoses. This will show if any patient has been admitted and what their clinical diagnoses have been in the past. The next two boxes offer any respiratory assessments that have been completed or treatments that have been done on a patient. And the next tab is your Quality Measures box. This will just show you if there's any kind of activity, quality improvement in the patient's past. This is the completion of this tutorial. Thank you very much, and we hope that this information will be valuable to you.